Hey doctors, you're listening to the Micropractice Mama podcast, a podcast for women physicians who are striving to practice primary care sustainably and creatively with autonomy, authenticity, and joy. I'm your host, Sonia Singh, internist, PCP, and proud mother of 2 human babies, 1 fur baby, and 1 life-changing micropractice. I want to empower you to push past whatever is holding you back and make the leap to launching a practice that aligns with your values and priorities and finally allows you to take care of your patients, your family, and yourself in the ways that you want and deserve. Are you ready to make the leap? Let's do it. Hey doctors. If you're part of the Micropractice Mama universe at all, you probably already know that my course, the Micropractice 101 e-course, is on sale this week, like major sale. And I probably should be doing an episode talking about the course and how awesome it is and convincing you to enroll in it and overcoming your objections to buying. But yesterday, I got an email from someone who attended my webinar last week and listens to the podcast. And she posed a really important question, and I just kept thinking about it. So here's what she said. She said, "Is it possible to be too burned out to start a DPC practice? Personally, I feel so burned out, I don't know if I want to take care of patients at all ever again. I wonder if I first have to build my empathy back up before starting my own micropractice. How do I know if that empathy will ever come back, and or what can I do to explore this within myself?" So I think the reason this email and this question struck such a chord with me is because I have been there. I have 100% felt what she is describing. And I really haven't talked about that in this podcast, and it's honestly a story that I have been trying to muster the courage to tell over the past several years. I did write about it a bit in an essay that I had in Annals of Internal Medicine called Open Letter to a Burned Out Intern, but that was written in a very general, broad strokes way, and I've never really told my full story in detail anywhere. And when I reflect on that, I think that it's probably because there's still parts of the story that I have shame about, and I have this fear that actually sharing it will blow my cover in some way. But after I read this email and actually just reflecting on all of the messages and emails I have gotten since I published that essay, I know that there are so many other physicians out there who felt that way and still feel or currently feel that way. And they're maybe now looking at me and thinking that I'm a different type of person or a different type of doctor, but I'm not. Like I am that person. I have been that person. So I thought maybe this email is a sign that it's time and I should go ahead and share it. So despite what would probably be best for my sales and my business, I decided today's episode, I'm going to go ahead and share the prequel to my path to micropractice. So in, I think, maybe episode 2, one or two, I shared my path from working in traditional primary care to starting my own micropractice. But part of the reason that I think I was able to make that big change and that big decision so quickly is because I had the experience of being profoundly burned out before. And during the first time that it happened, I really did not have insight, didn't know that it was happening. And so the second time it happened, which was right before I quit my job, I recognized it much more quickly and was like, oh no, we're not doing this again. I've got to make a change. So I do think sharing this part of the story, it's an important and relevant part for people to know, and that I think hopefully other people can relate to. So I think this story really starts when I arrived at my first day or week of residency, and that was in the summer of 2013. I had, for the most part, done really well in medical school. I enjoyed it. I got my first choice for IM residency in the match. I had honored, I think, almost all of my 3rd and 4th year rotations. I have always been a good test taker, and so I had really good board scores. And I'm telling you these things not to brag, but to share with you how all the objective data there was really pointed to the fact that I was qualified and well prepared to be there. But I felt internally like I was completely unqualified and a total imposter, and any minute somebody was going to realize that I knew nothing and I should not be allowed to be around patients. I mean, if imposter syndrome could be measured, if the severity would be measured by like the delta between what actually is and what is your perception, I had like severe stage 4 terminal imposter syndrome. And I guess it's something that had affected me at other times in my life, but never to this extent. Like I never felt so deeply unqualified or unworthy of being somewhere as I did when I started residency. And I still honestly, I probably need to explore this in therapy. I don't know where that came from. I'm not sure why at that time in my life I felt so particularly afflicted by this. But I remember feeling it from the minute I stepped on that hospital campus, like orientation week, before we were even really doing any real medicine. Somebody would make a comment about something, and if there was anything in what they said that I didn't already know, to me it was immediate confirmation that I was a moron and I should not be there, and everybody knew more than me, and any minute they were going to realize. That was the attitude that I stepped onto campus with. And on top of that, I think I've always probably had some level of high-functioning anxiety that kind of waxes and wanes. I would say for the first few weeks of residency, I was in this state of very heightened anxiety about everything and kind of over-preparing and double and triple checking. So my first rotation was VA wards. And I had rotated the VA at my medical school so many times. It felt like a very like of all the places I could have started, I knew CPRS, I knew the vibe of the vets. I was always very good with the vets. That was a good place for me to start. It was a very good, comfortable place for me to start. And yet, I remember my hands literally shaking, putting in my first order, which was for like Tylenol 650 PRN. Like I was so afraid of missing something, so afraid of not knowing the answer to something on rounds, so afraid of making a bad decision, or which in retrospect, a lot of these things I had no reason to be afraid of because I was being watched so carefully. I was an intern. There were so many people looking over me and watching what I did. So I just had this very high level of anxiety. And I remember one day I was like presenting something on rounds and my attending was like, "Are you sleeping at night? Because I feel like you're just going home and reading Up to Date and then showing up here the next day and reciting it. Like, I don't know where you're getting these hours because it doesn't seem like you're doing anything besides being here and preparing for being here." And at the time, I just took that as a compliment. I was like, oh, he thinks I'm very prepared. And that same attending at the end of that first rotation, I remember he sat down with me, and if I ever see him again or if we cross paths, I'm going to tell him he was so right about this and just he hit the nail on the head. But he sat down with me in my first feedback, and he was like, "I see how hard you're working. I see how hard you're trying. But the pace of what you're trying to do right now is totally unsustainable, and I'm worried about you." And again, in that moment, I don't know, I took it as a compliment and I was like, "Oh, you'll see, I can do this. I can do this for years. I've been doing this for years. Don't you worry. You have no idea how much I can prepare. I will keep doing it." But he was right and I was wrong. I definitely could not sustain that level of anxiety and that level of over preparation and that level of double and triple checking. And I think at the time on the outside, I was probably performing okay. I did cry when a neurosurgeon yelled at me, but my co-intern cried too, so I didn't think that was that strange. My poor senior just didn't really know how to react to us both crying, and I remember he bought us like really sad sandwiches from the VA canteen to cheer us up. But I made it through the rotation, and at the time, I didn't really think any of what I was experiencing internally or externally was abnormal. But within probably 2 or 3 months, like just a few months later, I found myself slipping. Like I just could not do the level of, like I physically and mentally could not do the level of preparation and checking that I wanted to do. I found myself feeling really deeply affected by things that I was seeing and experiencing in the hospital, emotional cases with patients. And I'm very bad at doing that compartmentalization and kind of separating myself. And so every bad outcome and every loss and every patient that yelled at me and every doctor that yelled at me, all of that I took so personally and took home with me and carried around. And all of that I felt very overwhelmed and overstimulated by everything that was happening, by the sounds, sights, smells of the hospital, by the events, every morning report, every noon conference. I'm sure I was like slightly tachycardic and sweating and in sympathetic overdrive. And that's just, you can't physically, that's like very hard to withstand for months and months. So probably by the fall of my intern year, I felt something was terribly wrong. Like I had to really give myself a pep talk to get out of bed and go to the hospital every morning. Like I was just dreading every minute of it. I felt like a shell of myself. I was not socializing. I felt like I didn't have the bandwidth or the energy to socialize. When I get anxious, I just completely lose my appetite. Like I feel like I physically cannot eat when I am anxious. So I was not eating. I lived by myself at the time, so I just was spiraling into this dark place of isolation, sadness, like physical depletion, sleep deprivation. Just, it was bad. It was very bad. So I remember reaching out to my mentor who I had been assigned to, but who I adored and felt really cared about me. And I still love and adore her. And she came to my wedding. But I reached out to her and I said, I'm struggling. I need to talk to you. I don't know what's wrong with me. I don't know how to fix it. I don't know what the answer is, but something is wrong. And I remember she took me out to dinner at this lovely little Italian restaurant. And by the time, by the time the waiter was putting the bread on the table, I was sobbing uncontrollably. Like I was just telling her, like, I don't even know if I should be a doctor. I don't know if I should be doing medicine because I'm deeply miserable and unhappy. And I dread going to work every single day. And she was so kind and empathetic and validating. I remember her saying, look, you're doing great. You're doing fine. No one is worried about you. You're doing really well. But I'm concerned that you're feeling this way on the inside. This is more than the typical kind of like intern stress or the med student to intern transition. This seems like more than that. To be honest with you, now I don't even remember what happened after that. Like maybe I felt a little better that she was just like, no, we don't think you're a total screw up. And I kept going. But I kept going. So I got through intern year and I was still miserable, still questioning if I should be there. Became more and more just like a shell of a human. I no longer was doing any of that double checking, over preparation. I was mentally shut down. I feel like I was a zombie just going through the motions of it because I was trying to survive and I could not be mentally or emotionally present for anything anymore because it was too much. So I was basically just going through the motions, and I think I missed out, actually. I think I arrived at residency very qualified and very prepared, and I think because I've shied away from so many opportunities to learn or take leadership, I probably then missed out on opportunities to grow and learn as a doctor. I was just constantly, don't look at me, don't ask me anything, don't give me another advent, literally just trying to get through each day. And my low point came very early in my second year when I was on nights. And this is going to sound so silly. And this is like a part of the story that I still just have insane shame and embarrassment around, which is just, again, I'm going to tell you it and you're going to be like, that is silly. But I was in the workroom on nights and there's like a bunch of us in the workroom. And an intern came up to me and asked me a question about potassium replacement. And when I was a third year, someone taught me something wrong about potassium replacement. And somehow 3 years went by and nobody, or 2 years, 3 years went by and nobody corrected me on this. So I don't know if it was just that I was under repleting potassium and then my seniors were just going in and adding some more without telling me. And I was just like, okay, whatever. Maybe they thought they wanted to give more. Who knows? But nobody outright corrected this wrong assumption that I had been taught. So somebody had told me when I was a third year that IV potassium increases your serum potassium more than oral potassium, sometimes double. And in my mind, when I was replacing potassium and if I was using IV, I would always double the expected increase of the serum potassium. Basically, I was under repleting potassium for my entire intern year. And this intern asked me, I explained my understanding of it to the best of my ability. And there's a bunch of other people in the workroom. And immediately somebody was like, wait, is that right? And me, of course, I always assume that I am probably wrong about everything. And like even stuff that I really deeply know for a fact, if somebody like calls that into question, I'm like, oh my God, it's probably wrong. So immediately when they said that, I like frantically looked it up and I was like, wait, I think I am wrong. And somebody else was like, yeah, I don't think that's right. And the incredible embarrassment and shame I felt in that moment where I was like, literally, an intern's job is just to replace electrolytes. And I have been effing that up for an entire year and 2 months. I cannot, it sounds such a silly little thing, but in that moment, I just wanted to die. Like I wanted to just spontaneously combust and disappear. And I remember thinking to myself, okay, I can never show my face in this hospital ever again. I can never step foot in here. I've got to disappear tonight or tomorrow morning and just never come back. And as silly as it sounds, that was the final straw for me, where I had just been miserable and wanting to quit for months and months. And that night I was like, okay, it's done. I'm quitting. I don't belong here. I'm a total screw up. Now everybody knows that I'm a fraud and I need to do something else with my life. So that night I sent an email to my program leadership and I requested a meeting and I told them that I'm strongly considering leaving the program. So I think it was like the very next day or maybe 2 days later, they took my request for that meeting very seriously and I met with somebody in my program leadership. And I remember walking into that meeting and he was just like, you want to quit residency? And I was like, yes, I do. He was like, are you sure? And I said, yes. And he was like, you want to quit a residency that you are almost halfway through at Stanford and you're just going to quit and throw it away. And I was just like, yes, yes, that's exactly what I want to do. And he asked me why. And I told him that I was miserable and that I wasn't enjoying anything about it, that there were no rotations I was looking forward to, that I was no longer even enjoying patient care, and that I was starting to feel like maybe clinical medicine was just not the right fit for me at all. And he said a few things to me that really stuck with me. And in a way, he was right. But I think in retrospect now, there are things that I wish were different about that conversation and that I hope are different 10 years later when people are having these conversations with trainees now. I think at the time he was doing the best he could. I don't fault anyone in my program. I don't fault the program culture or anything like that. I actually think it was generally a very positive, non-malignant program. There were a lot of people there that I know cared about me and were trying to support me through this. But in that moment, he said, residency has a way of unmasking mental illness. So do you think maybe you might just be depressed, or maybe there's anxiety, or maybe there's something else that needs to be addressed? And I honestly had not really entertained that possibility. In my mind, it was so clear that my unhappiness was being caused by this thing, by residency, by doing this work. So it felt so strange to me to think of it as a completely separate thing that needed treatment. But I was willing to take any advice or guidance that someone had to offer. So when he said that, he said, let me set you up with our wellness counselor. I don't remember exactly what they called it. This is like a wellness person that's here to support our residents who are struggling. And so I went to go see that person who was a psychiatrist. And basically it seemed like his role was to just talk with residents who were struggling and for it to be off the record, not official diagnosis or treatment of anything. I went to a few sessions with him and I wasn't sure if I was really finding it helpful. He just validated, yeah, residency is really hard and it might not be the right choice for you, but I can't tell you whether it's the right choice for you or not. And I think in our second or third session, I tried to pin him down and say, do you think I'm depressed? Do you think I have major depression? Do I need treatment for this? Because by that point, once the idea had entered my head, I was looking through the list of criteria and I thought, I have this. I meet these criteria. I checked almost every box of the SIGI CAPS criteria. So once I started thinking about it, I was like, I clearly am depressed. And at that time, I remember when I was trying to quit, my parents were completely panicked. I remember telling my mom, like, I hope sometimes when I'm driving to work that I'll just get hit by a truck because like I don't want to be there that badly. And then sometimes I think, what if I get hit by a truck and I get injured but I don't die and they just take me to the hospital and I get patched up and then I have to keep working. That would be the worst thing. It's so morbid to laugh about that, but those are the literal thoughts that I was having on a regular basis. True passive SI. And somehow I had gone this long without recognizing in myself that was major depression or having anybody else tell me that was major depression. Anyway, I tried to pin him down on that. And he said, well, in this setting, I can't formally diagnose you with anything and I can't treat you with anything. I am just here as a resource. And then I started asking him hypothetical questions. I was like, so hypothetically, if you did think that I was depressed, what medication and what dose might you think was appropriate? And he gave me some ideas. And I ended up asking a physician I know to write me a script for Lexapro. And I struggled a lot with this, and perhaps this is a little bit of a tangent, but I think if you are a physician who is currently right now struggling like that and you're trying to figure out what to do, I want to share my thoughts on this so in case they are helpful to you. But my big hurdle with treating depression in this circumstance was that I felt like it was a consequence of choices that I was making. No one was forcing me to be in residency. I was there voluntarily. And that was so clearly the thing that was making me feel that way. So it only seemed logical that if that is the cause of my affliction, then I should just take that part away. I should not do that anymore. And then I will not have that problem. There was this part of me that felt like, why would I medicate myself to get through the life that I've chosen, something that I've chosen to do? And the reality of it was I would have loved to do therapy or to get into formal CBT or to start exercising or hiking or to socialize more. But by the time I was in this position and realizing that I needed help, none of that stuff felt remotely feasible or possible to me. Like I did not have the bandwidth. I probably could have come up with the money, just could not have. I don't know how I would have done any of those things realistically, given the state that I was in at that moment. I decided to go ahead and give it a try. I just thought, okay, like I owe it to myself to just at least try what these people are suggesting or implying to me. And in the meantime, I had explored a lot of alternative paths. When I was really seriously trying to quit, I tried to quit right before I went on a vacation. And I basically told my program director, I'm going to go on this vacation and I'm not going to come back. And he was like, please just use the vacation to think about this. You can message me the night before and you can let me know your decision. But please just spend those 2 weeks thinking about it. So in those 2 weeks, I explored a lot of alternative options. I was looking into preventive medicine residencies, which are mostly non-clinical or minimally clinical. And I was talking to a few different program directors in those residencies who were just like, yeah, we'll take you. Come on over. I really thought that was the path that I was going to take. Like, I was just like, I must not be right for clinical medicine. I've always been interested in public health. Maybe that was really the right path for me. And what finally changed my mind was I spoke to a dean at my medical school who I'd always felt understood me and had looked to for guidance. And I reached out to him and I was like, hey, I'm a year and almost a half into residency and I desperately want to quit. And I don't know if I'm making the right decision. I don't know what to do. Please tell me what I should do. And I remember he called me and basically said, I'm not worried about you. You're in internal medicine. If you never want to set foot in a hospital again, you can practice medicine in a way that allows you to never set foot in a hospital again. If you never want to speak to a patient again, you can do bronchs or colonoscopies all day. There's so many ways to practice medicine, especially internal medicine. So he was like, I just think you're going to close too many doors if you leave at this point. You're already almost halfway through. If you can get through the next couple years, you'll be golden. You'll have so many more opportunities than you would otherwise, and you can make this whatever you want to make it. And I'm so grateful for him to have said that, because here I am now, like all these over 10 years later, and I practice medicine exactly how I want. I never set foot in a hospital. I never do any of the things that I think caused me the most stress and anxiety back at that time. But it was really hard to imagine that, certainly in those moments. But so he was the one that kind of pushed me over the edge to say, okay, like this is a temporary thing. I've just got to get through this next year and a half. I've got to find a way to get through it. And maybe medication and treating what is obviously at this point pathologic depression will help me do that. I started the Lexapro, and the difference of me on Lexapro versus me not on Lexapro, I think, can be exemplified very well by this one example that I can remember, which is I was on an ID rotation, and it was the day before the last day of the rotation. And the attending was like, I think it was like 6 p.m. We had just finished rounding at 6 p.m. I remember the attending looked at me and she was like, oh, by the way, you're supposed to do a presentation while you're on this rotation. And I was like, what? And she was like, yeah, so just prepare something for tomorrow. Now, the normal me would have flipped out, gone home, spent like hours just deciding a topic, then spent hours preparing a slide presentation, then spent hours preparing for it, probably just would not have slept all night, and then would have showed up the next day and given this presentation. Me on Lexapro, I went home, I just picked a topic, I put together a mediocre presentation, and I gave it the next day, and it was a mediocre presentation. And the reality was that presentation did not matter at all for my life. There were no consequences of that being a B+ presentation versus an A+ presentation. In a way, I'm not proud of the doctor that I was on Lexapro, but I needed to be that kind of doctor to get through that year and a half. I remember another situation where an attending had asked me to do something. It was like totally her call, her decision. And then this cardiologist paged me and told me to call him. And I called him and he just yelled at me for 10 minutes for this decision that I had nothing to do with. And the normal me would have been beat down by that for a week. I would have been beating myself up for it for days and days. I would have cried. Like I would have had this huge reaction to that situation. And I remember just, I had called him back on the hallway phone and he just yelled at me and I just took it. And then I hung up and my new attending was like, what was that about? And I just was over it and moved on and just was like, it had nothing to do with me, whatever, just let him get it out. Who cares? So even though I think some of my reactions to things when I was not medicated are part of my personality, is who I am, and I wouldn't want those erased or blunted forever. But in that time, I needed something to take the edge off. I needed something to prevent me from spiraling in those situations. And I am so grateful that something existed at that time to help me do that. And within probably 2 or 3 months of starting the medication, I started to feel substantially better. Like I was sleeping more. I had the energy to make dinner for myself. I was eating more. I was starting to exercise regularly, which I think made a really big difference generally for my mental health and my well-being. I started socializing a bit more. So I think then after a few months, I was able to do some of those other lifestyle things. I started writing again. So I started to do some of the other things that I think have helped me maintain my well-being since then. And I actually ended up stopping it after 6 months. And in my mind, I stopped it thinking, okay, this is here if I need it again. Like if I get into this spot or get anywhere close to it, I know this thing works and will help me and I can use it again. And here I am like over a decade later and I actually have never had to use it again. Wouldn't have been shameful or bad or anything if I did, but I haven't. But I can't say enough. Like I've told people before, like medication has saved my life. Like I've self-disclosed this to patients sometimes when I see that they clearly need help and they're very resistant because they have some of the same hang-ups as I did. And I share because I want them to understand like there is no shame. Like even the most highly functional, successful people sometimes need a little bit of help. And so I'm so grateful that person in leadership made that suggestion to me and sent me to a person who helped me see that maybe I did need something. And I'm grateful that I had access to someone that could give me that medication. I just want to take a moment to step back and say how I wish something like this would have played out now in hindsight, having had years more to reflect on this. I think one fundamental problem with how we address burnout among trainees and residents, actually not just trainees and residents, among everybody in medicine, is we have this tendency to put the onus on the person who's burned out, like to put the blame and responsibility on them for the problem. When the reality is, it is a system and a culture of training and the demands of training that result in this phenomenon of burnout. And often I think it is the people who are more sensitive, more easily overwhelmed, more emotionally invested. There's a certain kind of phenotype that I think is maybe more prone to burnout. And I really thought at that time that maybe having that phenotype made me not a good doctor and made me not right for medicine and made me not belong there. And now, having all these years of experience, I feel like actually a lot of those qualities are the things that make me a good primary care doctor and that have attracted patients to me and to my practice over the years. And first, punish people, I think, for having some of those qualities is sad and a shame and a loss. But also, I think the way that sentence was phrased to me of residency has a way of unmasking mental illness, it made it seem as though I was always this depressed, anxious person, and residency just unmasked that. But again, the reality is this is not a normal circumstance. It's not normal to see people die on a regular basis. It's not normal to work 80 hours a week. It's not normal to work 6 days a week and not get enough sleep. None of that is normal or conducive to good mental, physical, or emotional well-being. And I wish that there was a little bit more acknowledgement in that conversation of, yeah, residency is really hard. Like, it is not something that supports your mental and physical well-being. And yes, this level of training we think is what is required for you to practice safely someday. And I understand that it sucks and it's really hard, but this is temporary. And what can we do in this moment to help support you to get you through it, you know? But again, I really think everyone in this situation was doing the best they could at that time. I don't fault anyone. I don't blame anyone. I don't, I really don't even think of any of these people negatively. I really think they were all trying to help me. But I think that message really needs to change. The other thing I wish is that although I did eventually, I think, get the care and what I needed, I would have been so grateful to have had a PCP, or even for them to have had some way to formally evaluate and diagnose me and provide me with a treatment plan rather than me weaseling it out of somebody and then asking a friend to prescribe it for me. Because I think that part of the reason that it went that way is because there's still a lot of stigma, and you're required to report in certain states when you apply for your medical license about psychiatric diagnoses. I think the way it was worded in all the applications I have done is if you have a condition that could impair your practice of medicine, then you have to report it, which I don't think that my 6-month history of Lexapro use has ever done that or does that. But I just think it's such a shame that people are held back from getting that kind of care and treating themselves because of some of these ongoing stigmas and barriers in our profession, which of all places, like, our profession should not have those, but we do. And one thing I think I learned about burnout and depression was how much your view is distorted when you are deep in burnout or depression. Like, your everything, I tell people now when I'm talking about depression that when you're in it, you have this feeling that it will never get better and nothing will ever change. And it's like the opposite of wearing rose-colored glasses. Like, you're just wearing shit-colored glasses, and everything around you just looks terrible and seems terrible and doomsday. And so that's how I felt in that time. I just thought, medicine is not right for me. I am terrible at it. I'm never going to be a good doctor. I should not be allowed to take care of patients. I should never do clinical care. I don't like clinical care. It's crazy to me to think about how I feel about medicine today, sitting here in this moment, versus how I felt at that time. But I remember it. And once I got out of that fog, after a few months on the Lexapro, I started, like I said, doing some of the things that had fallen apart when I was burned out and depressed. And there are a few other things that I think helped me pull out of it. One was I had been living alone for a long time. And first I moved in with a roommate, which I think was helpful. And she had a dog. It was like having a therapy fluffy. And then after that, I ended up moving in with my family, which I remember when I interviewed for residency in the Bay Area, I was a little judgmental about all these people who were like living with their parents again. I was like, how can you do that? You're like 30 years old. How are you moving back in with your parents? And I ended up 30 years old moving back in with my family, saved a lot of money on rent, but more importantly, had the built-in social and emotional support and readily available food, which was really helpful for me at that time. I ended up doing an away rotation in medical journalism in New York. And I think just having that month to be in a different environment away from the hospital, using a different part of my brain, being reminded of how much I knew and how much value I could add in other places besides just in a hospital setting was really reaffirming and validating and inspiring. And that, I think, doing that rotation really helped. That also prompted me to start writing again. So I had a blog at the time with just personal essays and writing. And so I started writing there. And then sometimes people at the hospital, like co-residents and attendings, would say, oh, I read your piece on blah, blah, blah. And that made me feel like, again, oh, maybe I do belong here. Maybe I have something to add. Maybe there's something I have to contribute here. I remember I submitted a perspective to the local NPR station, and I got to record it, and it was on the air. And like a random attending that I didn't know stopped me on rounds and was like, I heard your perspective. And again, I wish I wasn't so dependent on this external validation to feel like I'm not an imposter, but those moments really helped. Those moments made me feel like, okay, maybe I have some value here, and maybe I'm not as much of a fraud as I have thought for all this time. And I remember I did that away rotation, and I also did a research month, which was also a really nice break from clinical medicine. And I remember after that, I went back to like the VA ER, like I did an ED rotation. And I remember being at that rotation and thinking, oh my God, this is fun. I like this. I actually like seeing patients. I like working them up. I like figuring stuff out. I like talking to them. And I was so grateful to have that feeling again, because I felt like I had not had that feeling since medical school. And I wasn't sure if it was ever going to come back. And it came back. And it's not one day it was just butterflies and rainbows, and then after that I was no longer burned out and I lived happily ever after. I think it took a long time for me to fully recover from that first year and a half when I was in that dark place. I finished residency and ended up taking a primary care job with the same institution. Again, evidence that I loved this place, and it was not anything they did that I think made me this way. I think it was just a combination of my own personality and temperament and strengths and weaknesses and the environment of medical training that made all of that go down the way it did. But I took a job there, and I actually asked to work 0.8 FTEs, even though I had no kids. I was not married, like nothing else going on. I just felt like I needed a break. Like I needed to process everything that had happened. And with that extra time, I took painting classes, writing classes in San Francisco. I did botanical drawing. I just did all these other things that I felt helped me decompress and process everything that I had been through. And I don't honestly think that I fully came to terms with everything and saw it clearly until I started my own practice, because I think working in a micro practice and being in complete control of my environment and crafting a practice that served me and catered to my strengths as a doctor, which are to be really detailed and slow and thorough and emotionally present and all of those things that I think contributed to my burnout in residency. It was only when I created a practice that supported all of those things that I realized all of those things were strengths. They were always strengths. It's just that I was never in an environment that nurtured or supported those. And a lot of us aren't in primary care. So that's basically my story. Probably left out some important details. I don't know. I should have outlined this before I started talking. But a big part of my motivation for sharing this is I feel like over the last few months, like ever since I've started this podcast, I get a lot of emails and DMs that are so kind and are like, oh, you're such an inspiration. Like, you're so amazing. And I still feel that feeling on the inside of being a fraud. And I want to emphasize how I'm not some unicorn. Like, I'm not a robot. I'm not somebody that's just always winning all the time. I have been in that deep, dark place of burnout, like deep, dark place. And I know how that feels. And if I can do this thing, then I believe that there's a lot of other doctors who feel that way that can do this thing. And I think those people still belong in medicine, even though they may be feeling that way right now. And I think that if you're hearing what I'm saying and thinking, oh my gosh, this person might have just left clinical medicine completely, and then this podcast wouldn't exist, and the e-course wouldn't exist, and all of her patients wouldn't have had her as a PCP, then I would say apply that same thinking to yourself. What a loss would it have been if I just quit medicine? And I think so many physicians, especially women physicians, do at some point in their career consider quitting medicine. And to me, it's just such a shame. And it's a casualty of this dysfunctional system and the rigor of training and this culture of not supporting our own well-being or certain, I think, personalities, temperaments, practice styles. And the beauty of micropractice is that you build it to support your strengths and temperaments and practice style, and you get to build the culture that you want and that supports you. So that is my story. I'm gonna have a major vulnerability hangover tomorrow. So I hope that if this was meaningful or meant something to you or helped you, I hope you'll reach out to me and let me know, because I say this all the time, like doing a podcast feels like you're talking into a void. And this was a doozy in terms of sharing things about myself. And I do it because I think, one, the antidote for shame is empathy. And so if there's other people feeling this right now, I want them to know that they're not alone and there's hope for them and it gets better and they are still good doctors and they belong here. So that's the end of my story. And today, I think rather than ending with my normal upbeat podcast theme song, I'm going to play you a song that I listened to a lot in that time, that year that I was burned out, and I associate with that time. And I still love in a bittersweet way because it makes me remember who I was then and how I felt and how far I've come. So here it is.
Took my love, took it down. Climbed the mountain and I turned around, and I saw my reflection in the snow-covered hills, till the landslide brought me down. Oh, mirror in the sky, what is love? Can the child within my heart rise above? Can I sail through the changing ocean tides? Can I handle the seasons of my life? Been afraid of changing, 'cause I built my life around you. But time makes you bolder, even children get older, and I'm getting older too. Well, I've been afraid of changing, 'cause I built my life around you. But time makes you older, even children get older, and I'm getting older too. Oh, I'm getting older too. I take my love, take it down. Oh, I climb the mountain and turn around, and if you see my reflection in the snow-covered hills, will the landslide bring it down? And if you see my reflection in the snow-covered hills, will the landslide bring it down? Well, the landslide will bring you down.